Over the next 2.5 minutes, I'm going to tell you 12 important facts about rabies. Be sure to watch to the end, because the last one might surprise you. Okay, here we go. Rabies is a vaccine-preventable, zoonotic viral disease that attacks the central nervous system and is almost always fatal once clinical symptoms appear. In up to 99% of human cases, transmission occurs through bites or scratches from infected dogs. However, other mammals, including cats, bats, livestock, and wildlife, can also carry the virus. The virus spreads via saliva contacting broken skin or mucous membranes, that is, eyes, mouth, or nose. Although transmission through the air has been reported, this is rare and usually occurs in bat-infested caves. It can also be acquired through organ transplants from infected donors. Globally, an estimated 59,000 deaths occur each year, with children under 15 years accounting for about 40% of fatalities. Rabies is present on all continents except Antarctica, but is very rare in the UK. In fact, the last human case was in 2003, and that was transmitted by a bat. The disease imposes an estimated annual economic burden of US $8.6 billion due to medical costs, lost income, and trauma. The incubation period, which is the time between exposure and the onset of symptoms, typically ranges from 1 to 3 months. However, it can vary from days to years depending on factors such as the site of the bite, the amount of virus introduced, and the individual's immune status. Early symptoms include fever, headache, and paresthesia, or itching at the site of exposure, as the virus progresses to the central nervous system. Patients develop neurological signs such as confusion, hydrophobia, which is fear of water, and aerophobia, which is fear of air. These symptoms lead rapidly to coma and death. Once neurological symptoms appear, rabies is virtually 100% fatal. There is no effective treatment at this stage. However, post-exposure prophylaxis, that's PEP, is life-saving if given promptly. PEP consists of 4 steps. Number 1, thorough wound washing with soap and water. Number 2, a course of human rabies vaccine. Number 3, rabies immunoglobulin, which is rigged for higher risk exposures such as those from dogs, cats, and monkeys. And number 4, 2 booster doses of the rabies vaccine. It's important to note that all bite or scratch exposures from potentially rabid animals require immediate medical evaluation. This is because even a tiny scratch from an infected animal can cause the disease. Also, people who are up to date with their vaccinations still require post-exposure prophylaxis if they have been bitten or scratched by a potentially rabid animal. The best way to prevent human rabies deaths is mass dog vaccination. Pre-exposure prophylaxis, that's PrEP, is recommended for people at high risk of exposure, such as veterinarians, wildlife biologists, and researchers who work with potentially rabid animals. It also is recommended for travelers to endemic areas. PrEP involves a series of 3 to 4 rabies vaccinations before potential exposure. And finally, avoid contact with stray or wild animals. Never feed or handle unfamiliar animals, even if they appear healthy, and seek travel health advice at least 8 weeks before visiting rabies endemic regions to arrange vaccination if needed. Thanks for watching. Bye-bye.